Hello, and on behalf of everyone at Otsuka, we hope you are staying safe and healthy. My name is Eli Perez, and I'm Director of Patient Advocacy and Stakeholder Management at Otsuka America Pharmaceutical. I'm happy to be here today discussing how the shelter-in-place restrictions are changing the daily lives of people living with Alzheimer's and their care partners. It is our goal today to share with you ideas, strategies, and resources for Alzheimer's, particularly as our lives are shaped by COVID-19. Our conversation today will cover 3 sections, and these videos will be divided into 3 corresponding episodes. First, we'll discuss how the dementia and Alzheimer's community is responding to COVID-19. Second, we'll review some solutions for the dementia and Alzheimer's community. And third, we'll take a look ahead and ask, what's next for the dementia and Alzheimer's community? I would also like to share that today's discussion is only one part of a series of videos. Please be sure to check out the others on mental health and caregiving, and keep an eye out for others to come. Now, let me introduce today's guests. Jackie Pinkowitz, who is the co-founder and serves as the board chair at the Dementia Action Alliance. Brenda Roberts is a dementia educator and advocate. Mark Roberts is an advocate living with dementia, Brenda's care partner and husband. Sophie is their Bichon and a trained dementia service dog, and Sue Peschin, who is the president and CEO of the Alliance for Aging Research. Good morning, everyone. So my first question is for you, Jackie. The Dementia Action Alliance plays such an important role in supporting families affected by Alzheimer's and other dementias. What is the Dementia Action Alliance and what is your mission? Also, what are you hearing about the COVID-19 pandemic and how it's impacting families and care partners during this very difficult time?
Yes. Eli, the Dementia Action Alliance is an incredibly broad coalition of individuals and families living with dementia, professionals and care partners, organizations, all of us wanting to change attitudes and the understanding about living with dementia in this country. I can't say it any better than the people who are on our advisory board, all living with dementia, who are our North Stars. And what they tell everyone is, we don't want to just survive. We want to live and thrive. And that's what DAA is all about, connecting people and changing hearts and minds in our country. And the harder part that you're talking about, Eli, obviously, is what we're hearing about the impact of this pandemic on families and care partners. I must tell you that we receive a lot of personal feedback because there's so much fear about what's happening and not much information about what to do about it. But we also collaborate with Us Against Alzheimer's, and we got just recently a lot of survey data from them showing that this pandemic is causing more stress, more isolation, more health and financial concerns among families, especially care partners whose loved ones are living at home. Let's remember that very often people who are living with dementia at home have wonderful day programs that they can go to. But that's not the case now. All of the day programs are shut and everyone is at home. And it is not surprising to us when we read that 80% of care partners surveyed indicated that their stress is much higher now than before the pandemic. A third indicated that the whole shelter-in-place restriction is absolutely causing more stress among all members of the family. And I think you can understand that. 3/4 of care partners were unsure what they would do if they got the pandemic. What would they do? What would their loved one do? And another third are unsure what would they decide to do if their loved one got the pandemic. I'm sure we're all very aware of what's going on in long-term care facilities right now. So when you put all of those pieces together, you have to add another piece. And it's a big piece because it's about care partners worrying about their families' financial health throughout this pandemic. So I guess, Eli, it's pretty obvious that families and individuals are having a very difficult time. And I don't mean to say that it's only those living with dementia. I think it's probably everyone in this country. But that's the information that we've been given, Eli.
Thank you very much for that, Jackie. Really appreciate that great information you just shared. I do want to highlight the idea that you called out, though, related to Dementia Action Alliance's mission of working with individuals who are living with dementia, right? They're living with it and they're living well. And that's a great segue to Brenda and Mark. Thank you both so much for joining us. Jackie spoke clearly about the impact that COVID is having on families during this difficult time, but we want to hear from you directly. How have your lives changed under the stay-at-home order? How have these changes impacted how you think about managing your future? Obviously, you're very much focused on the current situation, but wondering how this is impacting your thinking about the future and how you'll continue to live through this pandemic.
Absolutely. I'll give kind of a broader answer, and then I'll let Mark talk a little bit about how it affects his daily life. We're in a situation that we're in a multi-generational family house that we built specifically because of wanting to be together as Mark's condition progresses and having lots of support. And during this time, it's a little different than some. I mean, every situation is different. But every adult in this house is one of the essential workers, including myself. And so since we are all essential workers, we are actually working longer hours. Now, I happen to work from home, always do. But so I'm busy, sequestered off into my work office. So what it has resulted for Mark is that he has much more alone time because we are all busy working, and then when we're finished with work, we really need some downtime. And so he has more time on his hands. I'll let him talk about what it's like, what changes he's had in his life, and then I'll answer a little bit more about what some future concerns might be. So Mark, you're a pretty active guy. You still drive around our community. So we live in a rural, small community. So Mark, what about you? He was asking about what changes have you had, honey, in your life now that COVID's here?
Well, I think that I don't get to, visit with people face to face, which we used to have coffee groups at McDonald's or whatever. But I enjoy, like I say, we're in a rural area, so I love the wildlife. So lots of times Sophie and I go for a ride and look for deer or other animals. It's either Brenda taking me or my son-in-law. I don't want to be a worrywart or someone who can't figure out how he can keep himself a little busy. And I have lots of help for that. But I still miss having my friends. I do call them. So that is a help, and that's what I've changed with that. But I can't go to, lots of folks want me to kind of tinker on some things to help them, and I can't go there to help them.
Well, and probably I think I'm going to guess that the number one thing is just the church stuff that Mark's involved in. No more choir practice, no more Bible study, all the, so our church family is really Mark's number one support group outside. We talk about building a team when you have a person living with dementia. Our church family is a big part of that team that supports us. And so that's been gone. And so I'm going to talk about the future. And I had a recent conversation. Mark and I have a gang. I call them a gang. And there's about 8 of us. And they all have dementia. And we were just talking last week about just COVID, what's happened. And they all are talking about, they see changes in their cognition. They really are seeing changes. They're not as sharp as they used to be. Mark has a much more difficult time initiating activity, tends to want to sleep more. And Mark, like I said, was driving around our community. And so, again, we're in a rural community. He has limited some of his driving, but he at least drives to church and McDonald's. That's a big deal, to be able to go out on at least a daily basis and do those things. And he hasn't been. So my concern is, as this goes on, is I kind of wonder, I see Mark changing, and I kind of wonder, will he be able to drive again? Will that be a skill that then he has lost, just because, who knows, even when this pandemic, but when some of the restrictions are lifted, we will still be staying home, even if our governor says you can go out, because Mark also is asthmatic and he's had a lung disease. And so we're very cautious about those concerns, those concerns as well. So, that's my concern, is the long-term effect on our friends' cognition in the progression of the disease. It really is speeding up the progression of the disease by the lack of socialization and the extra worry. It's so interesting. We had a conversation with one person who's living alone, and she talked about walking outside, and everybody were in units, husband and wife, or families, unless they were running and jogging. They were social distancing, but there was at least another person. She had no one. She's living alone with dementia. She had no one. And how hard that is for her. And so then we had another friend who talked about his wife was now home. She usually worked. And now it's like, all of a sudden being retired and being with your spouse 24 hours. So there's all different kinds of situations.
Absolutely. Thank you so much for that, Mark and Brenda. Thank you for giving us a glimpse into your lives and how you've been impacted. The isolation that this pandemic is causing is of so much concern, and it's so important to address. Thank you for all that information you just shared. Now I want to turn over to Sue. The Alliance for Aging Research focuses on advancing research that leads to healthier, more productive aging. So I'm just wondering, how has the pandemic shifted the way you and your organization are thinking about the care and treatment of Alzheimer's?
It has. Thank you for the question. And also thank you so much to OTSCA for doing this series of videos. I think all of us are looking for ways to have connection during this time. And it's nice when you can see people that are going through similar experiences as you. And I think it's terrific that Mark and Brenda in particular are participating with us today, because it means so much to families with the stigma that this illness brings socially, to have folks that are willing to come forward and say, we know what it's like. I think there's a couple of different layers in terms of what the pandemic has brought up for folks, not just in the dementia space, but I would say for the aging community in general, because we work a lot across aging. We work on Alzheimer's disease issues and other dementias for sure. We actually convene a coalition called Accelerate Cure and Treatments for All Dementias that bring patient advocacy groups together with industry and researchers. But I think it's raising issues across the aging community in institutionalized settings like nursing homes and assisted living, as well as for folks who are at home. Because quite frankly, a lot of folks that care for people with dementia may be older themselves or may be at risk for COVID-19 themselves. So there's workforce issues that folks are dealing with. There's certainly the social isolation and some of the issues that the other speakers have already raised. And then there's, issues related to clinical development and the clinical trials that are going on to try to find new treatments for this condition that have, in many cases, had to be halted or delayed in certain ways. So it really affects things across the board.